Good afternoon. My name is Rebecca Ladd, and on behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. Today we're changing things up a little bit. We're honored to welcome Natrona County Health Officer Dr. Dow to answer your questions about COVID-19 in our community. So we're going to jump right into it and welcome Dr. Dow to the podium.
Thank you.
Dr. Dow, the first question we have today. We know that the information about COVID-19 is growing and changing. There are so many different models and graphs out there predicting peak infection rates and dates. Totally honest, some of them are difficult to come to terms with. How long do you think we can expect to be severely impacted by this in our community, and when do we foresee the curve flattening to a manageable level?
Well, I'm glad you asked that. I'm as confused by the models as everyone, and depending on where you look and read, you'll get different answers. I will say this, we're at the very beginning of this from my side. I think we're entering to a rapid phase for the next perhaps 3 to 4 weeks at a minimum. I think we may flatten the curve here in May, maybe early May, but we don't know that yet. The problem is we're a rural area and a rural state, and so we're really not sure how this is going to play out compared to New York and Detroit. So right now, I'd say consider this impacting this area a lot through May, but we'll see.
Right now in Natrona County, we have 14 positive cases, with the most recent being confirmed this morning. When a test comes back as confirmed, either the state or local health department is contacting that patient, advising them to self-quarantine, and then conducting contact tracing. We know that contact tracing involves contacting anyone who has been in recent close contact with the positive patient. Can you please further explain contact tracing, and specifically, if someone is at risk of being exposed to a positive case, will they be notified?
Here's how we do it. We identify a case as positive. So the health department will call you and ask you, where have you traveled? Who else has traveled in your family? Has anybody been exposed to anyone else that's in self-quarantine or been around someone like that? Once we get that information, we ask the close contacts of the person that's positive. We go ahead and say to them, now if you've had prolonged contact, you must be self-quarantined for 14 days. We give them the information about the signs and symptoms of getting ill. Obviously, if they get ill, then they're going to call the health department or their healthcare provider immediately and discuss it. We are checking on a daily basis with the person that is infected to see how they're doing anyway. And while we call them, we'll ask them how their family members are doing. So it's a really good system. That way no one falls through the cracks.
With the positive cases we currently have in Natrona County, do we know the current conditions of any of those patients in terms of recovery, or if any have been hospitalized?
Well, we're tracking all of them because we're doing all this contact tracing, and because we have a tight medical community, we can communicate and watch what's going on. No one from Natrona County has been hospitalized yet. Everyone that we're following is recovering, some faster than others, and that's good news. But I want to make it clear that that can be really misleading because sooner or later, based on national and local projections, we will get some people that are quite ill. We have older people in the community. Someone will get ill and get hospitalized. We're ready for that, but the news so far is good.
We received several different questions regarding medication or treatment for COVID-19. Are there any treatments out there that the public should know about?
Well, you've heard nationally about hydroxychloroquine, which is used for diseases like rheumatoid arthritis and lupus normally, and azithromycin, which a lot of you know as a Z-Pak. And they're used in combination in very ill patients right now as a salvage treatment. The studies are ongoing, and as you hear Dr. Fauci at the national level saying on a regular basis, we don't know if they work well, but they're the best we have at the moment. But if we don't do the studies to prove or disprove, then we won't know what to do down the road. Other drugs like acyclovir and Tamiflu have no activity whatsoever against this particular virus. There are a lot of other studies, and in fact, we're looking at some old AIDS drugs right now that might be helpful, but nothing is tried and true at the moment.
Here in the Emergency Operations Center, we've been working to prepare our community as best we can for this pandemic. We recently stood up our community medical shelter at the Westwood facility here in Casper. We're unique here in Wyoming that while we're going through this, we're also watching other areas of the world who are ahead of us. What's the point in a community medical shelter?
This is fantastic, and I want to applaud everyone in our county for doing this proactively. So we have folks that may not be able to take care of themselves at home. We have people that are homeless. We have people at the mission. When someone gets ill and they have nowhere to go, we now have a place to put them for public safety and for their safety until their testing comes back. And then we can put them other places if we need to, and we're working on that system now in case they need to be quarantined, or they can be released back into their previous setting. So this is just not for homeless people, but also for the elderly and other people that don't have anyone to help them at home. It's a great system. It's already in place so that if we do get hit hard by this, we're ready to go.
There is information circling across the internet, specifically on social media, of individuals supposedly selling COVID-19 tests. Is it a good idea to purchase your own test? What are the risks of this?
Don't do it. Do not purchase your own tests. They're not accurate. They're not reliable. We need a system in the county and the state to track every single test and everybody that is positive. We have a system set up in the county that is great. We have limited testing centers so that we can track everything. We know how long it takes to get the test back. Here in Natrona County, we're able to get tests down to the state health department every day, 7 days a week, to get results the same day. So we have a great system. Do not go there. It doesn't work, and it will mislead the public, and it'll hurt us as a county because we won't know who's getting tested. So don't do it.
There's a lot of discussion nationally about a shortage of testing, which means that counties, even us here in Natrona County, have to be really careful about who gets tested. Can you please help us understand why some people get tested and why others don't?
Great question. We are testing as a priority. Healthcare providers, first responders especially, because we have to have those people in the front lines and we have to know if someone's getting ill. And I cannot emphasize enough, we start losing our nurses, our first responders, our doctors, quarantining everybody. We don't have an infinite employee pool here in the county, and we have to be careful with what we do. Just as important, other hospitals, nursing homes, long-term care facilities, those over 65, those with immune problems. Those are the priorities. So when we go and test at the state lab, we actually mark on the form, are they a high priority, a medium priority? So somebody 65 and older that's healthy is a medium priority, or are they 25, otherwise healthy and not very ill? They would be a low priority. Obviously, a high priority would also be somebody that's hospitalized. So based on that, since there's limited testing, obviously if a physician is acting like they have COVID-19, we want that test result back quickly, or a hospitalized patient. The system we have set up with the state is great, and it will be loosened as we have availability of more testing. But we have to preserve what we have in the state now, although the future looks bright for expanded testing.
Someone gets the virus, how long are they contagious? Is a recovered person able to be infected by the virus a second time after recovery?
Okay, now, this is all changing, like so much of this information, even today, will probably change in a week. But as we understand the virus now, from the day that you are infected, you could potentially be contagious. We know that sometimes 2 days before you're actually sick, you may be spreading the virus. That's part of the problem. To say that you could go back to work, for example, no fever for 72 hours while not taking Tylenol, or 7 days since your first symptoms, theoretically you could go back to work. But let's say you're a nurse and you've been ill and you got better. I want you to wear a mask when you go back to work for 14 days from the day that you got ill for 14 days. And that doesn't have to be a nurse. That could be at any place that you work in the county. So a 14-day window to be safe. I think that's where we're going right now, and we're going to stay there for the time being anyway.
The possibility that somebody could contract the virus a second time.
Oh, yeah. Yes, I think that it's quite possible that, let's say you got COVID-19 and you recovered, and then you got exposed a second time because it was out in the community, because it's not going to hit us for 5 minutes and then be gone. It's going to smolder for quite a while. You could get infected again, but your immune system should recover quickly from that because it'll remember it from the first time. You may not have any symptoms at all, or you may be so mildly ill that you would never know the difference. We're not seeing reports of people getting infected a second time and becoming severely ill. I'm really not worried about that part of it. We don't know whether somebody that gets infected a second time is still shedding the virus for a while after. That information is not known yet.
Is it possible to get a false negative test if somebody is tested too quickly after a potential exposure?
If you're testing after an exposure, you're probably not going to test unless you're starting to show symptoms. So if you did test too early, maybe a day or two after you became infected, the test might be negative. But once somebody is showing early symptoms, very early symptoms, then their test should be positive. Occasionally, there's a negative test. No test is perfect, but that's the exception. A time we might repeat the test would be in someone that's severely ill in a hospital, and we know they have it, and we run the test and it's negative. It might make a huge difference in terms of isolation, and so we might repeat the test one extra time, but as a general rule, we don't do that.
In regards to patients who have tested positive, once they get the positive test back, what happens? Are they told to self-quarantine? At what point are healthcare professionals checking back in if they need further?
Well, what we do is if you have a positive test, you're in self-quarantine for basically the parameters we talked about before until you have no fever for 72 hours or you've been well for a week, something like that. But we're checking with you on a regular basis to see how you're doing and giving you advice about that. We're also checking on your home situation when the home health nurses call, the healthcare nurses call, to see whether you understand how to quarantine away from your family and instructing you on how to do that. So there's a lot of education that goes on.
We've talked a lot about different closures happening in the community and across the nation, but bringing it back to the basics, what are the very first symptoms we should be looking out for as possible COVID-19 symptoms?
Well, it's interesting. The more we learn about it, the more we realize that even in different areas of the world, the symptoms are a little bit different. We diagnosed somebody out there, and their first symptom was they lost their ability to smell and taste. And then a day or two later, they got ill. And so they said, yeah, I couldn't taste or anything, and I couldn't smell anything in my house. And so that is an interesting hint sometimes that we never hear about in medicine. You really are looking for shortness of breath, a new cough, some of you cough out there, some people smoke, and they have a smoker's cough, but this is much worse than that. Or you're running a temperature of 99.5 or so, you're becoming ill, you're walking around and you just can't breathe right. You pick up the phone, you can call the hotline at the county health department, which we set up specifically for advice. You can call the respiratory clinic, which we set up in the community for testing and triage, or you can call your provider. What we don't want you doing is using the ER as a triage center. That's dangerous for everyone. That's not the point. Go to the triage areas, make the phone calls, unless you're really, really sick. Now, if you're really sick, call the ER, tell them you're on your way in, and go there. We don't want to take chances on you. But those are the things we're looking for right now. However, what we're going to ask you is, do you know anybody else that's ill right now and what symptoms they have? And have you hung out with them a lot? Because that's going to clue us in as to what you might have. So that's another thing. What we teach in medicine is the history is so important. And if you ask the right questions, it'll lead you where you need to go. And so we're doing that. Everybody is trained in triage now.
A family member or somebody in our home who's exhibiting symptoms or they test positive, how do we care for that person and protect the other individuals in our home?
That's hard. If there is a strong suspicion in the family somebody may be infected, you try to isolate them within the home. And that is really not practical in a lot of homes, but you can try. Wipe down surfaces, wipe down refrigerator holders, wipe down doorknobs, have them use their own bathroom, have them clean their own dishes, have them sleep in another part of the house. Maybe if you have a mask or one of the cloth masks that everybody's making in town right now, put them in that, and then the rest of the family want to wear one as well. But you try to minimize exposure. But you communicate as a family, and if the person that may be getting sicker and sicker, you need to get them involved in the healthcare system. But you've got to call somebody to let them know that you think somebody in the family may have COVID-19. Don't take a chance, don't guess, go ahead and make the call. We have those numbers and the access out there to help the public, and we can't help you if we don't know what's going on in your family. So.
The last question we have today. We're all doing our best to avoid overbuying at grocery stores, which sometimes means we have to go a couple times a week. How do we keep ourselves safe when buying groceries? What are some tips in regard to washing fruits and vegetables?
Okay. At the moment, fruits and vegetables are perfectly safe. They're not carrying the virus, and I wouldn't worry about that. What I want you to do is when you go to a grocery store, you use a wipe on that shopping cart every time. Then socially distance while you're shopping. When you leave, hand gel. You've got to use the hand gel. But do I spend my time worrying about my groceries to where I go home and waste all the wipes that are in my house cleaning off my can of soup? Don't do that. We don't have the supplies in town. It's a waste of time. Don't do that. Hand gel, hand washing. But if you go into an establishment and they do not have wipes for you to clean the shopping cart, go somewhere else. And they should have hand gel there for you. I suggest that anybody that has hand gel, put it in your vehicle, keep it there, use it liberally. Also wash your hands, but obviously hand gel is key here.
And at this point, we'd like to just give you an opportunity if there's anything else that you would like to add.
Pay attention to what's out there from the Natrona County Health Department, the CDC. We try to do updates all the time from a county and city level. We're keeping you informed. Don't panic. We've got a great system set up. We will disseminate information. Just follow what we need you to do. Socially distance, follow the rules, keep your groupings very small, and we can all get this taken care of and protect our people in the county. Thank you very much for asking me to do this, and
thank you all for joining us for today's Natrona County Emergency Operations Center COVID-19 News Brief. As a reminder, you can watch back this news brief on the Casper-Natrona County Health Department Facebook page or the City of Casper YouTube page. Until we see you on Friday, please keep yourselves and your families healthy and safe. Thank you.